Good afternoon, everybody. Jing sent me Mike's bio by email, and I threw it out because I figured that I probably didn't need it, and then I told him that I was just going to wing it, and he said, don't say anything at all. So I'm in this sort of torn situation. What I do want to say is that, you know, we all know Mike. We all know him as a really nice guy who helps us out a lot around here, but he's also like a super international expert in his field, and he's going to talk about his work today, and that's really exciting. Welcome, Mike.
Oh, no pressure. Yeah, thanks, Sarah. What I would like to do today is actually give you this talk that I've actually given in a few other places and in different venues. And some of you may have heard bits and pieces of this in different forums. So I apologize for that. But the idea here is actually to pull together a bunch of research that I've been involved with probably over about the last 10 years, which is sort of on this idea. Well, I'll tell you what it's about. So here's really the challenge, which is the basis for all this work, is that when we actually think about environment today, we really ought to be thinking about health of cities. Because right now, so in Canada, 81% of the population lives in cities. By 2050, 70% of the world's population will live in urban areas. And in fact, urban areas will absorb all of the future population growth of the world. So the rural populations will actually remain relatively stable or decrease, and all the growth that we're going to experience over the next however many years until the growth stabilizes will occur in cities. So it's really a challenge to actually, how do we actually absorb all these people into cities in a way that not only doesn't lead to ill health, but actually could even improve the health of the inhabitants of cities. So I'm going to first talk about air pollution, but then I'm going to get into some other things. So this is kind of my basic air pollution 101 slide to get everybody up to speed about air pollution and health. Why do we actually care about air pollution? Well, actually the risk for any one person of being exposed to polluted air is actually usually quite small. So being exposed to polluted air is not going to be the major determinant of whether or not you as an individual are sick or healthy. But what makes it important from a population health perspective is that everybody's exposed. We actually can't avoid this exposure. Unlike many other exposures that you're faced with, you actually can avoid them. So if you're talking about an occupational exposure, you can choose perhaps to leave that workplace and work somewhere else where you don't have that exposure. You can choose what you eat, for example, but actually you can't really choose to breathe or not. And in fact, you usually can't even choose to move away from an area. So the fact that everyone's exposed makes that the risk of air pollution from a population health perspective a large impact on the population. The other point is that as we understand the health impacts of air quality better and better, we're increasingly certain that there's actually, from a population perspective, no threshold. So again, every individual does have a threshold below which you won't experience any ill effects. But on the population, the responses are variable, and there are people that are much more sensitive than others. We really can't detect a threshold that's really anywhere above the background level. So essentially, what it means is that the more we improve air quality, the more public health benefits. What does the research tell us? Well, hundreds of studies now done in different cities in the world say that on days when air pollution goes up, more people die. We also know if we compare people living in different cities or different regions of countries in more polluted places, people die earlier than people living in less polluted areas. And in the more polluted areas of cities, so in neighborhoods, that same juxtaposition exists as well. So in the most polluted areas, there's an increased risk of dying. Here's just one example. A really large study done in Canada. This is actually following 2.1 million non-immigrant census in 91 death statistics. And basically what you can see, and without going into all the details, is there's a relationship between deaths, cardiovascular or total mortality, as well as deaths from stroke, ischemic heart disease, and essentially getting down to background levels, very, very low, low levels. That's just one example. This is another quite a famous example. This is a study following about 20,000 people living in 6 different cities in the U.S. At the time of enrollment, everybody's still alive. You follow people out for 20 years, and actually the people who lived in the most polluted cities were less likely to have survived by 20 years, after 20 years compared to people living in the cleaner cities. And again, this kind of study has been replicated in other locations. So just some examples. So those are now 2 studies in a relatively clean part of the world. If you now think about translating that information into more polluted parts of the world, Central and Eastern Europe, Middle East and Asia, for example, you can see actually that the population health impacts become quite large. So this is a plot from the global burden of disease. Quantify the causes of death and disability around the world, as look at various risk factors for that death and disability. And what you can see from this analysis is that ambient air pollution is the 9th leading cause of disability, so morbidity and mortality in the world. It's associated with 3 million deaths per year, and it's actually among the top 5 in some parts of the world. So it's the 4th largest risk factor for death and disability in China, for example. The other point about this is that these impacts, this is actually unlikely to go away. And one of the reasons is what I mentioned before, which is urbanization. So as more people move to cities, they're actually moving to places where the air is more polluted. Then there's also demographic and epidemiologic transition. So as people live longer, they're actually more susceptible to the health impacts of air pollution. So most of these deaths from air pollution actually are occurring in people over 60 or so who have actually developed chronic lung or chronic heart disease. So that the pool of susceptible people is going to increase actually because of improvements in public health. So we're actually getting decreases in infant mortality, decreases in infectious diseases, allowing people to live longer. That actually sets them up to be affected by air pollution. The other thing that's happening is that as countries develop, they're taking on many of the bad habits that we've taken on, such as low physical activity, poor diets, which all contribute to chronic heart, chronic lung disease, the kinds of things, again, that are affected by air pollution. So here's the situation in Canada. I think it's number 11 in the list of risk factors, responsible for 7,000 or so deaths per year. And this, again, just some projections about this increase that I mentioned. Again, this really is not, this is looking over the next 40 years or so. And this increase, again, is not because pollution's getting worse. It's actually because of these changes in the underlying population. So that's really important to understand that even if pollution stays the same or even goes down slightly, actually the impacts are likely to get worse just because of the underlying population and changes with that. So we do know actually how to deal with this problem, and in fact we have dealt with this problem. So that's the good news. So this is actually a picture of Vancouver False Creek at noon in 1939. Doesn't look so nice. And of course this is how it looks today. And actually the levels of air pollution, so these are levels of particulate matter in the air in Vancouver, are among the cleanest in the world for a city of this size. And just to put this in some perspective, sort of background in the world today is around 4 micrograms per cubic meter. We're just a little bit above that, whereas what we're seeing, for example, in some cities in China is 100, 120, 150 for an annual average. So we're very clean. How did we get clean? Well, we put in a lot of air quality management. We did things like emission control, tall stacks, zoning. We've had large airshed management programs where we looked at all the sources and we categorized the sources of pollution and restricted them and put controls on them. And then a special emphasis on motor vehicle emissions, improvements in engine technology, inspection and maintenance programs, things like air care, changes in the fuel quality. All of these things have made a huge difference. So it's not a mystery actually how to deal with this problem. It's just a matter of doing it. And you can also see the health benefits of these kinds of changes. So this is actually a study done in Hong Kong looking at just changes in the sulfur content of fuel. So just one actually small change. What you can see here is quite a dramatic drop in the levels of sulfur dioxide in Hong Kong after this, and so actually the change began earlier. This is when you had to have made that change. So many suppliers and sources actually made the change somewhat earlier. A drop in the air pollution levels, and if you look, for example, at respiratory mortality, there's a seasonal pattern, which is actually primarily driven by influenza. And but actually, the year after that sulfur was changed, you actually have lost that winter peak in mortality. Now, actually, people still have to die. We can't make them immortal. So you do. That would be nice, maybe. So you do get that later, but essentially what you've done is actually bought people an extra year of life by that change. So quite dramatic impact. Here's another analysis. This is looking at changes that were implemented across the U.S. Over a 20-year period. So this is actually the level of reduction in particulate matter over a 20-year period. And this is life expectancy. Looking at counties across the U.S., what you can see is there's a relationship. So the places that cleaned up the most have the largest increase in life expectancy. But of course, there's tons of scatter here. And that's as you'd expect. Air pollution does not predict life expectancy perfectly. It shouldn't. There's lots of other things. There's healthcare, there's diet, there's physical activity, there's smoking, there's alcohol, et cetera, et cetera. But it does have a relationship. And the estimates are that of the about 3 years of increased life expectancy that we're seeing on average across the US over this period, about 15% of that could be attributable to improvements in air pollution. So again, very dramatic. Why? Because everybody benefits, right? And in the US, actually the federal government, whenever they pass a benefit assessment of this, so they do this every year, and it's costly. They're also the ones that provide the most benefits by far. In fact, the benefits of the air quality regulations are greater than all other federal regulations passed in any year. But more importantly, it's the ratio. So the benefit to cost ratios, depending on what year you look at and depending on what regulation, are at least a 4-to-1, in some cases a 30-to-1. So $30 for every dollar you spend. And what are the $30 that you're getting? That's improvements in health. So it seems like it's worth doing. And so what have we done? So we've actually done a lot to having urban component. And then also these sort of local hotspots. We still actually have these sort of those for differences in health. And that's sort of what I'm going to talk about now. What's driving those in most of our cities are actually gradients in pollution related to major traffic corridors. So this is for a whole bunch of pollutants. What you can see is these are all just sort of normalized to the level that you would see right at the edge of a road. And as you move 100, 200, 300, depending on the pollutant, up to 500 meters away, you get a decrease in the level of those pollutants. That makes sense, right? So these gradients can be quite sharp. For some pollutants, the gradients are very shallow. Some pollutants, there's no gradient at all. What that means is if you happen to be spending some significant amount of time within 100, 200, 300 meters of a major traffic corridor, you're exposed more than somebody else. And what we're finding actually is that if you happen to be in this zone compared to this zone, we can actually detect a relationship with many measures of health. So this is just summarized actually in an article that Perry Highstead and Connor Reynolds to graduates of UBC grads, just came out last week or 2 weeks ago, where we basically were saying three things. This is sort of putting a Canadian perspective on this, that there's a lot of studies that show exposure to this sort of traffic mix is related to health impacts. We did some estimates of what percentage of the Canadian population was exposed, and that turns out to be about a third. And then also outline some strategies for how to mitigate this problem, approaches that you could take. And in another analysis, actually, Ryan Allen at Simon Fraser led that we were also contributing to, looking at school locations in Canadian cities, and same kind of thing. About a third of primary schools in large Canadian cities are also located within this sort of traffic influence zone, as defined here. What do we know about health? So a number of years ago, we developed some approaches here where we could do very detailed spatial models of air pollution. And you've probably heard some talks already about the idea here is you make many measurements across the region. At those same measurement locations, you also characterize the geography, so what predicts pollution around that area. And if you get a nice relationship, then you can use that relationship to predict pollution at unmeasured locations. And so this is a picture of what we think the traffic-related air pollution levels look like in Metro Vancouver. If you then take this and now relate it to where people are living and are looking at various measures of health, you can probe for associations between exposure to traffic-related air pollution and these health outcomes. So what do we see? Well, we see, for example, if we're looking at birth outcomes, that we see a relationship between birth weight and preterm birth. So living within 50 meters of a provincial highway, you have a 20% increased risk of giving birth to a low birth weight baby. Bronchiolitis, which is a respiratory infection, and it's the main reason that children in the first year of life are hospitalized. Again, if you're in that zone, you have about a 6% increased risk of developing bronchiolitis. It seems to be associated with about 15% of new asthma cases, and this is very similar to results found in Southern California. And about 10% of middle ear infections, which is the #1 reason young kids actually see a physician or get prescribed an antibiotic. So this is looking at children, a number of health outcomes. And again, these may not seem like big risks, but because the population, we're talking now about a third of the population perhaps being in this zone, and that's why you get these numbers like this, that about 15% of all childhood asthma may be attributable to this. Looking at adult health. This is looking at death from coronary heart disease. If you happen to live within, and this is now 50 meters of a highway, but you can do it for 100 meters of a highway or different zones. But if you happen to live within 50 meters of a highway compared to not, you're at about a 50% increased risk of dying from heart disease. What was really interesting in this study is that we also compared people who moved. And so if you actually moved closer to traffic during the period where we followed you, your risk was almost as high as if you'd been living close to traffic the whole time. But more importantly, if you moved away from traffic, your risk dropped almost down to baseline, almost down to the level of people who never live close to traffic. So it's kind of like quitting air pollution. You still have a slightly increased risk, about 10% increased risk of dying from coronary heart disease, but nowhere near if you had lived close to traffic that whole time. So if you quit the pollution exposure, you seem to reduce your risk. So not everybody can afford to move, but you could actually move the road. So here's just an example of how this could be done or has been done. A freeway actually in Munich, Germany, and it's one of the major roads that led to sort of the ring road going around the city. So there it is right there. And what have they done? They've actually tunneled it. And now it's a really nice linear park. They actually scrub the pollution. So you can see here's the entrance to the tunnel. And there's ventilation towers, a few places where they actually scrub the pollution. This looks really kind of crazy and costly, but now think about it. Would you rather live in a place like this, or would you rather live in a place like this? So what happens is property values go up. You've actually got new land to build on. It's a nice park. And these things actually probably make money in terms of the whole city. And as I'll get into now you've actually got a transportation corridor where people can walk or cycle or take other forms of active transportation and not actually rely on cars. So there's a safe sort of transit route right through the city as well. So that's one example. Now this one there's no health study been done yet, but maybe there will be at some point. Here's another example of a study where changes were made to traffic flow, actually for nothing to do with air pollution, just for congestion purposes, and there's also health benefits. So this is a study in the New Jersey Turnpike. They looked at, these are toll plazas, they looked at births in women who live within 2 kilometers of the toll plaza compared to women who were still living within 2 kilometers of the freeway. And then they compared before and after this Easy Pass system. So this is a transponder system where you pay your toll. So before you have to actually stop, pay your toll, so the cars would line up, there'd be a lot of congestion, a lot of pollution. Now everything just flows through. And surprisingly, this change, there was a reduction in premature births by about 10% and low birth weight babies by about 12%. Again, the reference group still were actually exposed to pollution. They were quite close to the freeway. So this is kind of a freebie, no cost actually in doing this, but it shows you actually the power of making these changes. So again, in that article I mentioned, we just talked about different types of exposure reduction measures, things that could be done both in the short term, medium term, and long term. And I won't go into the details of them here. Some examples on low emission. Present in about 300 cities in Europe, where if you want to go into the center of the city, you have to pay a tax, so you don't even know except when you get your bill. There's some places that have what's called a low emission zone, whereas you don't have to pay a toll to go in the center of the city, but your car, the most recent or a hybrid or something like that, otherwise you actually get a fine for going in that zone. There have been a few analyses of these programs done, and actually the benefits, the health benefits are actually quite modest, and so are the air pollution benefits. And one reason is actually because there are still people that will go in here, and there's still a lot of congestion, and there's a lot of public transit in there, and that public transit, so if that's all diesel buses, or in the case of London, it's all diesel taxis and buses, actually it's quite polluted in there as well. So these, I would say, have been sort of modestly successful, but it's the kind of thing that has been done. And you do measure some health benefits in this case. So that's all about air pollution. Enough about air pollution. There's also other things related to the built environment that are also probably things like green space. And we have how walkable our cities are. And then, of course, we have air pollution. Mostly these are actually, we consider them separately when we're doing studies. And I think that's just been, it's simple. We can wrap our heads around it. But they actually probably interact in really complex ways. And the kinds of things that we've been doing over the last couple of years have been trying to figure out sort of how to look at these sort of interactions. Just to give you a bit of perspective, you're probably all well aware related to physical inactivity or lack of inactivity. They're also really important in terms of disease burden. So physical inactivity itself, high body mass index, and high blood pressure, which are also related to exercise. And globally, obesity and physical inactivity are really big deals in terms of health, and that's certainly true in Canada as well. Again, most people are probably aware of this, but Canada, and it decreases as you get older. Recommended levels of sort of the population at risk for things like diabetes, heart disease, and actually many other diseases. So how can we actually promote more physical activity? So we can tell people to go to the gym. That works for some people if you're already motivated. Much easier to actually try and help people integrate it into their daily life. Or actually, at the very least, try and remove the barriers for people that want to integrate it into their daily life. And you actually had a talk on this, the beginning of the term from Larry Frank. There's been lots of work that's actually physical activity to urban form. So we know in cities that are highly urbanized that people are more likely to use transit or walk. And actually, when you use transit, you end up using more physical activity than if you just get in a car. And that the land use mix, for example, is related to the probability of somebody being obese as well. So the bottom line here is that design of cities actually influences physical activity, and that influences health. Just like I said with air pollution. But what happens when we look at the two things together? So this is a little analysis thing, how to model or a map of walkability, how walkable are neighborhoods in Metro Vancouver. And we had our air pollution map. We put the two together. And lo and behold, what you find is actually most places, those two cancel each other out. So the places that are most walkable, what does that mean? That means very dense. There's a lot of stuff there that people want to go to. It means there's a lot of mixed use. Those are the places actually that have you're closest to traffic as well, right? So a suburb where you live is 10 kilometers from a mall. That's not very walkable, and that's also there's a lot of air and there's a lot of space, and not a lot of pollution there. So actually, most places things cancel each other out. And then there's also some places that are sort of doubly bad. So places that are not very walkable and also have a lot of traffic pollution. So I won't name names there, but you can see. And very few places that sort of are walkable and have low air pollution as well. And these tend to be very high income areas, sort of urban islands. So Shaughnessy is one example of that. So it's very walkable, but it doesn't have any major traffic corridors sort of going right through it. Not accessible to everybody. So does this make a difference? I said these things, by and large, actually tend to cancel each other out. And we did an analysis in Los Angeles. So this is done by Steve Hankey, who's a grad student at the University of Minnesota, him and his supervisor, Julian Marshall. We had a Los Angeles, for about 30,000 people. We knew where they went over the course of a week. We knew how much time they spent getting exercise, so we could estimate whether they got the recommended levels of physical activity either by their commuting patterns, whether they walked or biked, or in their leisure time physical activity. And we also knew where they lived. So what we did for these people is we estimated their exposure to air pollution and estimated their exposure to physical inactivity. And then we broke down the population in terms of people who lived in more walkable areas versus, more walkable or less walkable areas. And what you can see is, so overall, the sort of impact of physical inactivity is greater than the impact of air pollution. So that's correct. But if you compare a low walkable to a high walkable neighborhood, so imagine now somebody moving from this neighborhood to this neighborhood, you can see there's actually a decrease in the, again, estimated deaths, in this case from ischemic heart disease. So you get fewer deaths per 100,000 people. But if you go from that low walkable neighborhood to a highly walkable neighborhood, you gain 9 air pollution deaths. So again, they seem to offset each other, at least in Los Angeles, and we've just replicated this for the whole US, essentially, and the same kind of thing holds. So it does seem like these things sort of cancel each other out. It means that we have to be a little bit smarter about how we design our cities. Look at 2 other things. Look at noise and air pollution. So you think about major sources of noise and air pollution, both being cars. You think, well, if you have a lot of traffic noise, you're going to have a lot of traffic pollution. It's not quite that simple because actually, if you think about when cars are noisiest, it's actually when they're going fast. And as long as cars aren't going too fast or accelerating, actually that's when they emit relatively low levels of air pollution. It's actually when cars are idling or accelerating from a stop that they emit the most air pollution. So these aren't perfectly correlated. But what we did, again, was we looked at health impacts. And again, this is looking at heart disease mortality. And what we're finding is that both of these seem to have independent effects. They don't add, or they're basically additive, but they don't multiply. So if you are in a noisy and polluted area, you're going to get sort of double the impact. So we also need to think about noise in addition to air pollution. The same kind of thing we looked at in terms of birth outcomes. If you just look here for birth weight, it actually looks like, so the noise, and this was sort of new work that really hadn't been done before, the effect of noise is much greater than the effect of air pollution. And actually may explain much of the sort of air pollution effect that has been seen in studies that sort of don't consider noise. How might that be happening? We don't really know. The most likely thing could be through sort of sleep disturbance. So if you're not actually getting good sleep, that may affect the pregnancy, the quality of the pregnancy, and then the birth weight. This is looking at green green space now. So this is an analysis done by Paul Villeneuve when he was at Health Canada. And what you can see here is that if you happen to live in a greener area, you actually have a decreased probability of dying from cardiovascular disease or just total mortality. So that's quite interesting. There's been quite a number of studies sort of looking at sort of stress-related responses in relation to exposure to green or natural spaces. And I think Larry Frank already mentioned this study. This is the one that really convinced me that something real is going on here. This is a study of a tree pest in the U.S. Midwest called the emerald ash borer. And basically it migrated starting here and then moved out into different counties across the U.S. And if you compare the time and the space, when this pest killed the emerald ash tree, more people would die. So there's this relationship between these trees dying and people dying in these communities. And it's really hard to actually think of other explanations. What else could be happening at the same places and time as the trees dying that could explain this? So this is really kind of a bit scary, but shows perhaps that there's a strong relationship between exposure to green or natural spaces and health. And that actually, if you think about it, that shouldn't be that surprising because we're evolutionarily supposed to be in a natural environment. This phenomenon of being in a city is relatively new. So how might green space affect health? It could be through providing an area where we have no oxygen. That's a bit of a misconception. But if you have a big park, there's no sources there. So it's kind of a buffer zone. They could provide places where you get physical activity. So a park is a place where you can get physical activity. So if you happen to live near a park, you're more likely to be physically active. Therefore, you might be healthier. Or there may be these psychological or psychosocial influences. So now you can see that so all these things interacting, and it gets really complicated. So I would say, have taken baby steps on this. And if any of you saw, Perry Heistad gave SPPH rounds on this a few weeks ago. This is sort of our first attempt. Again, we're looking at pregnancy outcomes. And we've looked at let's just look here at term birth weight. So this is the effective green space living in close to your home. And there's about, this is a 40-gram increase in term birth weight related to the related to the level of green space. If we adjust for socioeconomic factors, that drops down to about 20 grams. But then when we add things like air pollution, different levels of air pollution, or noise, nothing changes. So it seems like there's an independent effect of living in a greener area, in a place that's greener, that leads to about a 20-gram increase in birth weight, regardless of your noise or your air pollution exposure. Now, is 20 grams important? Again, for an individual, probably not. But if you think about the whole population, let's say somebody who has all kinds of other risk factors, maybe that is what matters. Let's see, how are we doing on time? So, what about solutions? And I'm going to talk a little bit about cycling, but actually much of what I'm going to say actually has to do, the same could be said for walking. And really, walking is the most common way that we actually get physical activity. Everybody can do it. It doesn't cost anything. You don't need pads or skates or a fancy bike or carbon fiber or anything. Everybody can walk. The problem is that you can't go that far walking, right? So in 20 minutes of cycling, you can go about 5 kilometers. 20 minutes of walking, you can go about 1 kilometer or so. So cycling is something that is faster, it's more efficient, it's nearly as accessible and economical. You do need a bike So it may be a more likely substitute for car travel, which is something that's related to all those other things that I've talked about: air pollution, noise, and in fact green space as well. So why aren't our cities green? Well, part of it's because we've put a lot of areas into roads, right, and infrastructure for traffic. So what about cycling? So actually there's been quite a few studies looking at this is cycling and walking and health benefits. And this is just a meta-analysis here, but there's improvement in health, so about around a 10% reduction in cardiovascular disease risk for people who actively commute, whether that's cycling or walking. And again, this is summarizing a whole bunch of different studies. Here's just one example. About 30,000 people in Denmark, followed up for about 15 years. Those who cycled to work for an average of 3 hours per week, there was a 40% lower mortality rate after 15 years. So again, you know, pretty big. This shouldn't be surprising. This is sort of just the effect of a physical activity. So you may think, well, yeah, I'd like to bike. It's great, but it's more dangerous. I'm going to get hit by a car, so that's not going to, you know, my if I get, and that's true. Kate Teskey here has done compiling stats for BC. What we actually see is that in terms of injuries, cycling is actually not much riskier than being in a car or being a pedestrian. It's definitely safer to be a bus passenger, and it's definitely worse to be a motorcyclist. So that's far riskier. In terms of fatalities, however, that was fatalities. In terms of injuries, cyclists are at greater risk than pedestrians or car passengers. So about double the risk of being injured than if you were a car. Again, still safer to be on a bus, still riskier to be in a motorcycle. But we actually have evidence that this level of this and where the rates of cycling and walking are relatively low compared to, let's say, countries like Denmark and the Netherlands, the injuries and fatalities are much greater. So the Netherlands, where there's much more cycling, there's much lower fatality rates or injury rates. So there may be sort of a safety in numbers phenomenon in that there's just more people. Also more drivers are aware, or drivers actually are cyclists at different times. Or it may have to do with things like infrastructure. And this is, again, a study that Kay has done here, showing actually that some types of infrastructure are much, in this case, car or train tracks. This is from Toronto, compared, let's say, to separated cycle tracks, so bike lanes where there's a physical separation. Those are actually a decreased risk of getting in an accident compared to other infrastructures to make cycling safer as well. Other risks about, let's say, cycling, and again, this would go for walking. This isn't something that I ever considered. You know, even somebody who studies air pollution and cycles, I never was interested in this topic. So obviously, it is something that people are thinking about. If I'm cycling in traffic, is it better for me to get that exercise while I'm breathing that pollution? Exposure, it's the concentration in the air, and it's also the duration. So if you're going from A to B, and you're going there by car, and car is twice as fast as cycling, no matter what the pollution level is, if you're taking you twice as long, you're going to have a higher exposure by cycling, 3 times more or 4 times more by walking. Now, that's not always the case. There are some commutes you can do where it's actually just as fast to walk or cycle than it is to sit in a car. But keep that in mind. Then the other thing is when you're cycling, and this is different than walking, is that the intake, which again, moving down, this is sort of closer to what would be associated with any health impact, is a function of the exposure, but then also how much you inhale. So what is your ventilation rate? And again, if you are cycling, your inhalation rate increases as well. So that's another factor. So what do we know? This is a few studies done now comparing people going from A to B by bike or by car, and essentially there's no difference. Okay, at least in these studies. So so there's really no difference in terms of the concentration that people were exposed to or the average exposure. Again, this time issue, though, obviously is going to vary from location to location. So if you are spending twice as long in a plume of traffic exhaust on a bike versus a car, or the other way around, right? There are places where if there's a traffic jam and you're in a car, you're actually going to be there longer, and you can see somebody on a bike scooting by you. That's going to affect your exposure. But there is sort of traffic route differences that will also make a difference. So this is a study that a few years ago did in different places in Vancouver. So there you can see sort of a low exposure, somewhat higher when she's on the bridge, lower again around the seawall, higher sort of downtown, etc. And so the high to low traffic route, again, about a 50% increase in exposure. Again, so now you've got all these different factors. What about health impacts? This is Christie's study, where she on sort of a downtown route and a residential route, measured both the air pollution, but also measured how much air they were breathing per minute, and then did some pre and post measures of some health indicators. So you can see the cleaner route is cleaner to those are just the two routes there. And what she found is that endothelial dysfunction, which is essentially a measure of blood vessel health, it improved actually when she was cycling on the clean route, so that exercise effect was there, but it actually decreased on the dirty route. So it seemed like when she was cycling in traffic that the benefits of exercise were actually counterbalanced by the effects of the pollution exposure. And then some other measures of inflammation and oxidative stress. There were small differences, again, in the same kind of direction, that they tended to sort of increase. Things were a little bit better, cycling on the cleaner route, a little bit worse on the dirtier route. But overall, I would say very modest differences. And probably what this means is we sort of have to think about, let's say, putting it all together. So do these things, these risks, these things like increased traffic crashes, compared to, and then the societal benefits, emissions of air pollution. So if you're on a bike and not in a car, other people benefit from that. How do those fit when we balance them all together? There have been a few sort of analyses that have tried to do this, about 10 of these now, and I would say none of them are perfect. Here's one, and they're all looking at different scenarios. This is one looking at the Netherlands, basically saying for short trips, we're going to move 500,000 people from cars to bikes for short trips. what did they find? They found overall a 9-to-1 benefit of doing that. So there were decreases in life expectancy related to traffic accidents or air pollution exposure, but they were outweighed by the physical activity benefits of that. Another study done of the bike share program in Barcelona, and they found a 96-to-1 benefit ratio. So that, again, the benefits of physical activity outweighed the risks of air pollution or traffic accidents there. So a lot of uncertainty here, but again, everything's sort of much greater than one. It seems to be much more beneficial. So just to wrap up here, so what I've tried to show you, and I think it's still really early days here, is that we're definitely seeing some health disparities associated with place within cities. What that means is that there are some parts of cities that are healthier than others, and actually that should be a guide for how we design the rest of cities. So we actually want to limit those disparities, not in a way that we make the good places bad. We want to make the bad places better. We've got some examples of interventions that seem to be successful. And there's actually some really good opportunities where we can be working together, where transportation experts can be working with health experts or air quality experts or people focused on climate change to actually improve things. What might this look like? Well, I showed you some examples. We have to be thinking about separating roadways from people. For much of modern history, transportation planners have been completely focused on how do we actually move vehicles through the city most efficiently. And that's actually what they should be doing if they're car planners, not transportation planners. If you're thinking about transportation, you actually want things to be best for people. And that may be thinking about people who are walking, people who are, skateboarding, rollerblading, biking, etc. And one way to do that is actually to think about separating vehicles, whether that's trucks that are primarily moving goods or vehicles that are moving cars, separating them actually from people. And that's actually better for cars, as well as people that are walking, cycling, etc. Given the physical activity challenge, infrastructure actually promote active transport. Primarily that means making it safe. That's the major deterrent, is either true safety or the perception of safety. And making things, it seems like we want to make things either green or blue. So people like water as well, whether it's green trees or blue for water. It should be clean in terms of low air pollution and also quiet. And I would say noise is something that's been really underappreciated in North America. It's got some real health impacts. And it's something that we just really haven't paid any attention to at all. And there are things that can be done in terms of road surface, tires, all kinds of things that actually would be rather simple to do. And could actually have health benefits. So I will stop there, and if there's time, take any questions.
I'll start with one, and later, if I have time, I get two questions. But the real question for now, it was interesting, Mike. A great presentation overall. But the thing about the dying elm or whatever, elm tree, has it come up at all the possibility that it could have something to do with isoprene? Like I don't know how much in all your travels and stuff you've talked about isoprene, but I've kind of been hearing about. There's not much attention to it, but isoprene has some toxicity and it's related to vegetation, and I just kind of wondered if that makes any sense.
Yeah, I mean, so it could be that trees are dying and that's the effect of sort of them not being around. It could be something emitted by the trees, sure. I mean, it would mean that I think something like isoprene or some biogenic emission from trees would have to be incredibly health promoting, right? Because the trees are dying, we're incredibly toxic, you know, to have that kind of an impact. I think it's just kind of an amazing observational study that I don't think anybody really knows what's going on. It's a huge effect.
I mean, just something that was thinking along the line of the question he asked was, I was actually wondering that the pests kill the trees and you see more people die. Could it be a case of confounding that maybe the pest is actually carrying a pathogen that is killing the people?
Yeah, it could be, but I don't think there's any evidence of, you know, this is a tree pest. Yeah, it could be. Or it could be something that's allowing the pest to flourish, right? So some environmental conditions. So I mean, there's lots of possibilities. It's just kind of, you know, it has to be something related to the trees because it's also, it's not just time. So you can't imagine, you know, let's say healthcare or something, because it's also space. It's actually different locations at different times. So it is something related to the trees, but yes, it could be that pathogen. Sure.
We've got Stephen Zhu online. He says, very impressive talk, Michael. While working in a hospital in China, I saw a study finding that the mean lifetime of road policemen in China was only about 45 years, 25 to 30 years shorter than the public. Do you think that the finding is possible and can be mainly explained by pollution exposure?
Yeah, I mean, I would think pollution exposure is, I mean, so we know from those studies of traffic police that they develop lung cancer, and I haven't seen many, there's one or two studies on heart disease, but they're kind of in the worst situation. So they've got the noise, they've got the pollution exposure, then they could actually get hit by a car as well. So it actually doesn't surprise me at all.
I guess we're all done. Thank you very much, Mike.